Hi, everybody. Thank you again for joining us. I'm Victoria Compton from the San Juan County Economic Development Council. We are an entity, a nonprofit entity. Actually, we're a very small nonprofit, and our mission is to help small businesses. That's our only mission with whatever businesses need. So if your business needs something, give us a call or send us an email. Our website is sanjuansedc.org, and we're waiting and ready to help you with whatever you need. Without further ado, I would like to welcome Kyle Dodd from San Juan County. He's going to be telling us about the next phase of reopening and the current one that just reopened and what we can expect and what are the requirements for those phases. And then after that, I am going to pass the mic over to John Gomez. And John, you'll be talking about unemployment insurance for business owners and other self-employed. And if anybody's got questions on the PPP, John, you are muted. So hang on a sec. Go ahead, John. You just shook your head. No, you're not going to be doing that? Okay, never mind. So I'm going to pass the mic over to Kyle. But if anybody has questions about the PPP or unemployment, let us know at the Q&A at the end, because we can answer any of those questions too. Kyle, do you want to go ahead and take it over?
Yes, thank you, Victoria. So good morning, everybody. Kyle Dodd. My day job is Environmental Health Manager for San Juan County Health and Community Services, and I have been serving as the incident commander of the county's COVID response team. So that's an incident command system term for the last 2.5 months now. I was invited here to speak a little bit about the governor's Safe Start phased reopening plan. But I just wanted to walk you through some details. I'm not sure how familiar everybody is with our current website, but a lot of the specific guidance documents that are being turned out by the governor's office and his team regarding specific phase 2 industry guidance for reopening, we have linked from our webpage. And before I go to those, I just want to point out some features here if everybody can see. So we have updated our San Juan County readiness. So this is a requirement for us to apply for a variance to go from phase 1 to phase 2. And these are all the different performance metrics that we are measuring and what our current status is there. And we will be updating this on a weekly basis. So that is located on the website just below what our case count link is, for those of you that have been tracking that. So to get to the business specific guidance, we have, and feel free and explore this if you haven't already, the public messaging part of our response. I'm extremely proud of getting both links and resources out to the community, keeping everybody updated on what's going on. So on the left-hand side, you'll go to resources for businesses and then preparing for reopening. And this link here will take you to the governor's page with all these site-specific reopening guidance documents. These two, the in-store retail and the manufacturing, were issued late last night. I haven't had a chance to go through them in any kind of detail. I skimmed the in-store retail, and there were a lot of similarities with the dine-in restaurants and taverns. So I guess I should ask: would it be helpful to kind of step through the high points of this document with folks?
I think that would be helpful. Actually, if we could just zip through those, that would be great.
Okay. Okay.
Thanks.
So before before I dive down deep into phase two, as all of you may know, we are in phase one as a county, and the governor has allowed 10 counties to apply for a variance to move to phase two. And there are some criteria. The county has to be have a population of less than 75,000 people and have not had any positive COVID cases within the last 3 weeks. At the time that he announced those 10 counties, we were initially not invited to the table there, but since that time, we have been. So the offer was extended to San Juan County to apply for a variance to move from phase one to phase two. And we are in the process of working through that variance application. And what that looks like is that the county health officer has to make a recommendation to our Board of Health. The Board of Health has to take action on that recommendation and approve it. And then it goes to the county council for approval. And if they approve it, then we are able to submit our application to the Secretary of Health. And the Secretary of Health will either approve or deny that application. And he has approved 8 variances already across the state, with 1 pending. So what the variance to go to phase two would allow is it would allow us to kind of separate ourselves from the rest of the state, where there are varying degrees of disease activity, and would allow us to proceed to phase two, which is more in line with the level of disease activity that we're seeing in our county. So we think it's an opportunity, and we are vigorously getting all that documentation together and working with our health officer on his recommendation to the Board of Health. So the Board of Health will meet this Friday, and Dr. James, our health officer, indicates that he will have a recommendation for them. As far as the timing after that, we hope to, assuming that the Board of Health approves it and the council approves it, we hope to have this variance application in at some point next week. So without looking into my crystal ball, that's as far out as I can go for now. So that's kind of the landscape with the governor's phases and where we are with the variance. Once we get to phase two, we cannot proceed to phase three until the rest of the state is ready, is my current level of understanding around that. I understand that things are changing rapidly, and that could change, but we're preparing ourselves just to get to phase two right now, which we think is a win-win for both the citizens and community businesses. So under phase two, any businesses that are preparing to reopen cannot reopen until there is site-specific guidance documents issued for that entity or business. And this is an example of the restaurant and tavern reopening guidance. And I'll scroll through a little bit and hit the high points. And then I'm certainly open to answering any other questions regarding phasing or specific to this document or the overall county response in general. So the important thing to note with these phase two guidance documents, and when I looked at the retail, it was very similar, is this is going to require the business owner to come up with a written procedure to ensure that they are following all of these requirements. And I know it's onerous, but keeping the total cases down is going to equate to keeping open. So I know there's a lot of frustration and frankly fatigue around this, but everybody needs to understand the importance of abiding by these, because this phase 2 is predicated upon keeping the number of positive cases down. The governor has said that it's a dial approach, and if this kind of phased relaxing of recommendations and restrictions results in additional outbreaks, then we run the risk of having to take a step backwards. So I know all of you know what's at stake, and I don't want to underscore that, just want to highlight that. And a written procedure will help each individual kind of work through that, what that means for your individual business, and kind of hit the high points here to make sure you have all your bases covered. So first thing I'll stop at is no bar seating permitted in phase 2. So if you have a bar, you must close that off. And I'm going to do a bit of speculating because we didn't get the entire transcript of how these were developed, but I'm guessing that the bar seating just results in that shoulder to shoulder atmosphere, so that's social distancing. And then if you have a bartender that's making drinks, they're often within that 6 feet as well. So no bar seating is the first one. Social distancing, which all of you are very familiar with outside of these site-specific documents, that's going to be a theme that's followed throughout for every industry, and we need to make sure that is still the case. Tables less than 5 guests. So if you have any larger tables, you'll have to either split those up or remove them, so we don't have any parties larger than 5. Occupancy is a big one. So for those of you that have studied the different phases, in phase 2, they have allowed restaurants at less than or equal to 50% capacity, and then in phase 3, that bumps up to 75%. The health officer has the ability to further restrict that. So just know that if you're working under these guidance documents, that may not be final. Stay tuned after Friday for any further changes to the capacity requirement. And that's similar to any specific businesses and or other gathering sizes or outdoor recreation as well. So the health officer can be more restrictive than the state and pick and choose under phase 2 if he so chooses. So the table spacing, again, that 6-foot social distancing, you need to make sure that from occupied chair to occupied chair, you've got that minimum of 6 feet, unless there is a physical barrier between the two. Number 7, cloth face masks. So as I'm around town, inside businesses and other public settings, I see a very high rate of people that are covering their faces inside businesses, and that's extremely important and something that we highlighted earlier in April as an important way to ensure that if we have asymptomatic people in the community, in other words, those that may be infected with the virus but are not showing symptoms, so they would otherwise not know that they could be spreading it, the cloth face coverings are a way to prohibit them from spreading germs. And all of us should be practicing that when we're in spaces where we can't keep that 6-foot social distancing. And this guidance document touches on it a couple times, one for customers, and it actually requires it for employees. So it doesn't have to be an N95, which we know are in short supply, but cloth face covering could be something from a local sewist. I know there are a lot of people making them, or something as simple as a bandana. Buffets, salad bars, anything that has the ability to be a vector, so shared utensils, all of that stuff is not permitted under phase 2. Number 9 is an important one that I'll highlight. And for those of you that serve raw shellfish and know under the food code what we require as far as complying with shellfish tags, this one is very similar to that. In other words, tracking who was in your establishment and some contact information for them for the purposes of contract tracing if we need to do that. So you'd have to have a daily log. Each individual would have to sign in and leave their telephone and email contact information, and you'd keep that on hand for 30 days. Again, the idea is if we have a positive case and our communicable disease nurses are following up and they determine that the positive case was in one of our local establishments, we can go to that establishment and request a list of their patrons over the prior 30 days and easily be able to reach out to those individuals and let them know that they were potentially exposed and give them guidance on quarantine. So that is really the backbone of preventing spread of disease in the community, is the ability for rapid case investigation and contact tracing, and is one of the reasons why we have been successful to date in limiting the community spread from the number of cases that we've had in the county. So the quicker you can identify the case, ensure that they are being tested, advise them to stay home while the test results are being run, and then isolate after that, the better off you are, so they're not moving about the community and potentially causing community spread. So that's going to be a little bit different. It may, folks may have an issue with leaving their name, telephone, and contact information. But again, just let them know what the public health significance of that is. And a lot of these are probably going to be met with some resistance. But again, I'll go back to this is where we're at, and in order to keep open, we need to be complying with these things. Number 10 is single-use menus, and some are doing this already, others are not. So this would be a change that folks can start getting ready for. The idea there is similar to the salad bar, where you have anything that can be touched by one individual and then touched by one or more other people without being disinfected in between. We want to minimize that. That's how the disease can be spread. So that goes along with the condiments as well. So anything that's going to be left on a table must be sanitized after each use. And if it can't be reasonably, then it should go to single use for those things. Number 12, so as part of the plan that we talked about initially, ensure that in any place in the establishment where folks can gather, that you have a plan to ensure that distancing occurs, whether it's tape marks or X's on the floor is what we've seen in places out there, or another way. We need to ensure that physical distancing is complied with as well. 13 is minimizing the number of staff serving a given table. So this goes back to reducing risk, and the more people, the more staff you have interacting with the table, the more potential for disease spread if there is somebody that is in the establishment as a positive case. So minimizing those interactions are the goal outlined in number 13. So employee safety and health. All the folks on the call that operate a food service are well aware of the emphasis that certainly our department places on employee health and safety. This guidance document and the atmosphere that we're in with this current outbreak really emphasizes the need to specifically ensure that all employees showing up for work do not exhibit any symptoms. And existing food service establishments have plans in place for that. This is taking it to the next level and specifically reaching out to each employee when they show up for a shift and screening them to ensure that they do not exhibit any symptoms.
Kyle?
So yes.
Sorry to interrupt. We've got a lot of different industries on the call. So this employee safety and health component, I think, is important for all industries. So I just wanted to mention that this isn't just for restaurants. Is that correct?
That's correct, Victoria. Okay. So I was highlighting the fact that
yes,
for food services, they're already somewhat familiar with this, and we can, when we get done with this, we can briefly click over to in-store retail. But this is going to be a common theme throughout all of the phase 2 reopening documents for all businesses in the county. So this may be old hat for food services, but for other businesses, this is going to be brand new and something that you'll have to key in on. So the social distancing piece, we've kind of talked about that. Personal protective equipment, and this is going to be similar whether you're a food service establishment or any other retail, is cloth facial coverings must be worn by every employee unless they are working alone outside on a job site. Or if they come in at 3 in the morning to prep and they're all alone, then that would be okay to not wear a cloth face mask covering. But this, the common theme throughout all these documents is going to be the requirement to wear face coverings. Hand washing, again, I think that's self-explanatory, but more emphasis is required. And for those that aren't food service operators, think of anything that any common areas that can be touched that need to be disinfected. And if you're a business that isn't a food service and you may not have your employees dialed into frequent hand washing, this would be a good time to have them focus on that. So here's the screening of employees for those symptoms. Again, that'll be a requirement of just about all the guidance documents as well. And this next one here, so as part of the plan, you'll have to identify somebody who is a COVID-19 supervisor. So somebody that's going to be doing the health screening, somebody that can ensure the social distancing piece, and otherwise compliance with all the parts and pieces of this plan. And then finally, there's no pre-opening inspection done by our department or anybody else. It's incumbent upon each business owner to ensure that they're meeting these, and that they shouldn't be opening and operating until they do have a plan in place, regardless of where we're at in that phasing. So that's the food service document. I'll pause there and ask if there are any questions about that specific guidance document, and then we can jump over to the in-store retail from there.
Yeah, Kyle, Krista has a question. Maybe you can clarify screening employees when they come to work, temperatures taken, or simply asking questions.
So the Cadillac plan would be having a thermometer available to actually screen for temperature. Again, that's not going to be something that everybody's going to have the initial capability for. But there are those infrared, no touch, forehead scan. That would be, again, the ideal. If that is not available, then it's just a quick questionnaire run through in a face-to-face. Any fever this morning? No. How about cough? No. Respiratory symptoms? No. So it's that one-on-one specific check.
Okay, and is a pulse oximeter a approved alternate method of screening employees, or is that still in the weeds?
So that would be that would give you an idea what the oxygen level in the blood is. That wouldn't be necessarily a particular screening tool for COVID.
Okay, thank you. We've got a couple other questions about accommodations and live music, but we'll hold those till the end, just to get through the this next section here, Kyle. Okay.
So when I was invited to speak, this was the main phase 2 document that had been published, and since then we have in-store retail operations guidance document as well. And I can just briefly step through that, and all of you on the call know how to access these from our website under the resources for business link. So we're linking out to the governor's page, and as these come online, you'll be able to access them from there as well. So contactless pay options, or pickup or delivery where possible. Again, we know that a lot of restaurants have gone to that as well. Guest occupancy. So whereas the restaurants are limited to 50%, this guidance document indicates 30% of building max, with the same requirement for the 6-foot physical social distancing as well, and ensuring that both customers and customer to customer interaction and also customer to employee interaction can maintain that. That is going to be tough in some of our smaller retail stores. So as part of the plan, your plan to reopen, you may think about having somebody keep an eye on the door and limiting the number of people coming in, so you can control that. There might not be any other way in some of the smaller businesses. So signage at the entrance to the store about the occupancy limit and the social distancing and face coverings as well. Social distancing and barriers between cashiers. So those of you that have been to our local grocery stores that have been working through this ever since the outbreak started, a lot of them have sneeze guards in place to ensure that there is that physical barrier between customers and employees. And that, again, that is a recommendation here where that 6 feet cannot be maintained. Some points on sanitation. Again, it cannot be underemphasized the need for all those high touch contact areas, door handles, racks, anything that's going to be frequently touched can be a potential surface where somebody else can touch and pick up the virus from those surfaces. So detailed cleaning cannot be underscored. So we have some information here on fitting rooms, and then malls, shopping centers. We'll just jump down here into the health and safety. And again, you'll find that this is very similar to the restaurants. So I think for those of you that that aren't a food service or don't fit in the in-store retail guidance, you're something else that would be in phase 2. You can expect this section to be a consistent throughout all these guidance documents. So the screening of employees, providing the cloth face mask, the frequent cleaning and sanitation, and then having somebody specific in the business that is going to be there to monitor the employee's health and monitor compliance with all of these new requirements. And same thing here. So it's the honor system. The agreement is that no business will reopen until they can meet and maintain all the requirements outlined in the guidance document. So that's that one. Again, I mentioned it before. I know that these are onerous, and a lot of folks are feeling kind of fatigued with all this. Our response has been ongoing and dragging out, and we have some of the same feelings. But again, if we can keep the cases down, that's what's going to have to happen to get open and stay open. So we're all in this together. I'm not going to pretend that I know how this has impacted each one of you specifically, but I can say that I have a pretty good idea that the impacts are great, and it has affected everybody in the community, in addition to businesses being hard hit. So hang in there, and we're doing what we can to get the variants in place to get to phase 2, and hopefully we'll be moving to that step in the near future. So I think I'll pause there again, Victoria, and certainly open to any questions on what I've said or anything, any other questions related to the overall response.
That's great. I'm going to go ahead and unmute everybody. If you want to stay muted, I think you might have to remute yourself, but this is probably the easiest way to open it up to questions and answers from the whole group. So here goes. I'm guessing that there are some maybe kayak companies or entities like that might have some questions too, because it's a little bit different. Okay, everybody's unmuted. So maybe let's go ahead and raise hands, and we'll keep an eye on, or just go ahead and dive in and ask any questions that you have. I'm kind of amazed.
So, there's a couple of questions in the chat. So maybe
chat box. Okay, I lost my chat box when I lost connectivity.
I've got it up. So Kathy at Lopez Farms Cottages asks, we assume accommodations are in phase 3 when non-essential travel is lifted. Kyle, can you speak to that?
That's correct. That's how we envision that as well. So the health officer order that's in place for transient accommodations essentially reinforces the governor's proclamation. So the governor requires everybody to be staying home. and not traveling unless it's for essential business or essential activities. And transient accommodations are limited to serving only those out here on essential business or completing essential activities. So in phase 3, when non-essential travel is allowed, that's when we believe that the health officer order will be lifted for those transient accommodations.
Okay. Our next question comes from Rick Hoffman. He says, is live music addressed? And I don't know if you have an overall guidance on this, or if Rick, if you're unmuted, maybe you want to just to speak a little bit on that.
Well, just a question, as restaurants open, a number of restaurants used to feature live music on occasion. And so it brings up questions. When can that happen again? Is that available under phase 2? Does it have to be solo acts, not bands? I don't know if anybody's dealt with this yet.
No, that's a good question, and I wouldn't. It certainly isn't addressed specifically in the phasing as it relates to performing at establishments. But I would say that if restaurants are open and they offer live music, as long as the performers can abide by the same criteria as an employee would, meaning the screening and the social distancing, I don't see a reason why that would be a prohibited activity.
All right, thank you.
Hello. Yeah.
Oh. Oh. Okay. Rick, does that help?
Hello.
Let's give you some. Hello.
Oh,
We can hear
okay.
you. Hi, who's this?
I'm muted.
You're unmuted.
Oh, we're unmuted.
We can hear you.
I think we've got some people unmuted. So let's go through and mute some people. Are
Okay.
there any other questions in the chat
Yes,
box?
there-
I lost the chat box
There-
when I lost connectivity.
I can.
Thanks, John.
I've got the chat box. Julia asks, what do we do to also comply with ADA requirements? Some of these issues with flow might contradict ADA. Julia, if you're unmuted, do you have any specific examples you can point to, just so we can, drill down on answering your question?
Hi, I have a coffee shop on Lopez, and we're just doing to-go only. And one conflict I find is people want to come up and down the same set of stairs.
Yeah, well, don't.
So I wanted to have them go a different direction to exit, so they don't interact with each other. But that also causes a problem for people who are maybe in a wheelchair and can't go downstairs, and so need to go to the ramp. Is there any kind of flexibility in allowing those individuals to come and go in a different pattern than the rest, or has that been addressed at all?
No, that hasn't, to my knowledge. And I would say it's going to be site specific for each business. Maybe there's a plan that if somebody needs the ramp to go both in and out, and going out is going to be against the grain, maybe you limit the number of people in until that individual is served, so they can then turn around and go out and then have the rest of the customers resume. So I think a lot of it's going to have to do with modification of specific operations if that social distancing piece can't be maintained, and maybe there's an opportunity for those folks in a wheelchair. They may be able to be served as walk-up customers as well. So
and
just thinking that through, that's kind of off the top of my head.
Right. Well, and to be clear, I won't have anyone inside. I don't quite have the kind of space that would allow it. So it's only going to be the window service to go. So we can probably maybe just serve them, where they are.
Sure.
Okay. Thanks.
Okay. That looks like it's cleared the questions that are in the chat box. We do have a few more minutes, and I know that there's some industries that are represented in our participants list that may not, specifically apply to the guidances we've gone over already. But if any of you who aren't necessarily retail or tavern have questions about, where your industry is going, this is certainly an opportunity to, speak up and, ask.
And you can unmute yourself if you just click the little microphone icon if you're already muted.
Yes. And if you have questions that come up later, you can email us or you can email Kyle. Is it okay if we share your email address, Kyle?
You betcha.
Okay, great. Since my chat box seems to be slightly explosive, if John or Mickey, if you could put that into the chat box, that'd be great. Thank you.
This is Krista. I have a couple questions. Kyle, in regards to the San Juan County dashboard, on there for PPE supply availability, it's greened out and you have 6 months for the county, 2 months on hand for facilities. Can you clarify for me what you mean, what that means for facilities?
Yeah, so we're currently working with medical providers and first responders to ensure that they have an adequate supply for 2 months, and that's what that's referred to. It's not necessarily all other businesses, and the county is also accumulating PPE as well to be able to backfill those medical providers and first responders if needed, and also take care of any PPE needs the county may have if the county needs to do any specific emergency response testing due to large outbreaks as well.
Oh, thank you. And then on the restaurant tavern reopening requirements, #1, the hand sanitizer should be available at the entry, in parentheses, assuming supply availability. That's kind of the big question. And I'm wondering, because it doesn't seem to be available right now in terms of wipes and stuff. So I'm just kind of wondering if when the governor chooses that parentheses statement, if the supply is not available, is it then assumed that they just don't have to have the sanitizer at the entry, or?
That's exactly how I read that, Krista. So obviously, they inserted a bit of realism in there, and knowing that supply chains are a bit tight, they left that caveat in there. I will highlight though that hand sanitizer is secondary to hand washing as far as the priorities to clean hands. So it should be done when hand washing is not available. But if you walk in a door and grab a handle and you're in an establishment and there's no sanitizer, I would just take a trip to the bathroom and wash hands with soap and water to cover that. So
okay.
Good question.
Thank you.
Any other questions in the chat box or otherwise? Kyle, thank you. There's actually a couple of manufacturers on the call today. Do you have any specific guidance for manufacturing companies in San Juan County?
So I don't currently. I think that so that guidance document that was released yesterday late afternoon, so phase 2 manufacturing facilities, you can get to that document again from the business resources section of our website, and as I just click on it right now. So we there's talk about the social distancing again between employees, cloth face coverings, all those employee safety and health requirements that we covered under the previous 2 guidance documents. Looks like are the main items as well. employee screening, again, is going to be key. It speaks to soap and running water for hand washing for those manufacturing locations that maybe don't have the benefit of having an employee restroom. That's going to be an important hygiene infrastructure piece that will need to be installed. And then it looks like there's signage requirements for employee education and hand washing as well. And then back to the frequent cleaning and disinfection of high touch surfaces. Employee health plan that we talked about again before with that screening. So a lot of common themes throughout, and there are a few unique items amongst all of these. But I would encourage any of the manufacturers. It's a four-page document. You can scroll through that, and there are links at the bottom of all these documents to get specific questions answered. So the governor has his business response center available to submit questions if you have a unique situation that isn't specifically covered by one of the guidance documents. I know that they have been responsive in clarifying questions around the intent of these guidance documents as well. Or again, you can certainly email myself, and if I don't have somebody on our team here that can help out, then we can at least know where to refer you.
Great, thank you, Kyle.
And just so everybody,
yes,
just so everybody's aware, I've been at Kyle's email address, and this website with all of the guidance documents are down in the chat. If you've been with us the whole time, you'll notice I keep popping it in. That's because some folks have arrived late and the chat box doesn't populate with everything that happened before they got here. So I just keep, I'll just keep refreshing that. So people who join late can have those links available to them.
Great.
We'll also have this available on our Facebook page, and with all of our links, and the recording of this meeting will be on our website probably a little after lunch.
Yes. Thank you, John. Okay, Kyle, any last comments for our businesses? Because we're getting close to the end of the meeting. So do you have any other advice or any other tips for us?
The last thing I'll say, Victoria, is again, I mentioned it briefly in my spiel there, but thank you all for hanging in there. And I know that this has been a huge disruption for everybody. But again, from the county's perspective, we're doing everything we can to control the spread. And the more successful we are in that realm, the faster we'll be able to move through these phases and get back to some sense of normalcy. So appreciate everybody's adherence to all the public health messaging and guidance that we've gotten out there over the last several months. As a response team and a county, and all of you are included, we should be proud of the response and the fact that the community is in the position that we are in relation to other parts of the state. So thank you for that, and have a great day.
Thank you, Kyle, and I second that. But first, a huge thank you for you coming today to tell us the whole scoop about the phases. And I do want to second that. Thank you for all of our business owners for hanging in there. And it is incredibly hard. So I just wanted to say thank you, and let us know if you need anything at all. So thanks, Kyle. Thanks, everybody.
Thank you.
Take care.